Hello. Today I want to talk about PCOS, and I just want to kind of offer an encouragement for women out there and just kind of update you on my situation and where things are headed, how things are going, and everything. And I guess the best way to start it off is I have my good and bad days. Um, as many of you probably know, mood swings are extremely common. Um, and I find that lately I seem to have issues with that. I mean, I'll have a lot of days where, I don't know, where I just get in a bad mood for no reason. And it's kind of funny because when I was younger, my family tend to kind of take notice of that, and I used to try to just brush it off as nothing, and I would kind of beat myself up about it. I would feel quite a bit insecure. And later found out that obviously it was pointing towards the condition itself. Now, that's not to say that I want to blame everything on my PCOS, but it helped me to understand better exactly what was going on and why I felt like I just couldn't get myself together some days. And I do have a lot of days like that actually, where I just feel blah. I feel in a mood. I don't know how to get myself together, how to function sometimes. Um, you know, Even my motivation is off from time to time. Now, is every day like this? Certainly not. Actually, the majority of the time, I rather enjoy my days. And do I feel depressed? Certainly not. But I can tell that it impacts my mood in a unique way. So, for any of you that are having a similar struggle, be encouraged. You're not alone. The mood swings are very normal. I know it can be difficult for you and those around you, but be encouraged that it's a very normal part of the condition. I find that doing things helps me, getting out, keeping busy. I think those are some of the things that really seem to help me. And of course, there is a fine line of overdoing that, but I mean, you have to kind of find, and it's hard, but you do have to find your happy medium and just learn what works for you. What is too much for you in a day? But I find for myself, it really helps me to stay busy and stay active. So, um, that's really helpful for me. I'm actually soon going to be looking into some volunteer opportunities. I've got a couple places I'm looking at, and I'm not exactly sure which one I'm going to go to yet, but I'll know a little more as I investigate them and see what they're about and all that. So I'll be checking that out. Um, so yeah, mood swings. Obviously, there's a lot of other symptoms that go along with PCOS. I'll give you a little more update on myself later. But there's a lot of other symptoms that go along with PCOS. There's the pain, there's the fatigue, I don't know if this is with every person, but I know for me, like, I get the nausea spells here and there. I think that might be related to a different issue, but I'm not certain. You got the diabetes, the elevated testosterone, and then any elevated hormone levels, essentially, or many, I should say, maybe not all. But, um, there's a lot of other symptoms, and I'm just here to encourage you. You're not alone. This is a very difficult condition to deal with, but it's also a very treatable condition, and I feel like I am very blessed to have the treatments that I've had for it. I basically just take medication for diabetes. For me, it was just as simple as that. I do acknowledge that there are other women that have other issues, and I have had some pain, and I do take medication for that. But other than that, and a few other medical issues, those are kind of the treatments that I have with mine. Now, every person's situation is different, and every person has different needs. The main thing that I wanted to get across is that you're not alone. There are varying symptoms of PCOS, mood swings being one of the top ones, I think, from what I've seen. You may have a lot of days where you have a good deal of pain. And I know for me, environment has had a huge impact on that. I noticed shortly after my wedding that I started having a lot of issues with that. I didn't have so many back at home, but I find that, being in a new environment seems to have impacted me health wise. Now I'm fine now. I've been able to start controlling it and doing things to help it, but the pain is normal. Pain is very normal. I'm not here to tell you it's pleasant or easy, but it's normal. I sound like a broken record probably, but I'm just here to tell you that you're not alone. I'm happy to talk. I'm happy to be an ear. If you have questions, concerns, anything, don't be afraid to post them in the comments. I do keep an eye on it. I'm not able to check it every day, unfortunately, but I do keep a close eye on it. So, and lately I have been checking it every day because I'm home for the summer. But I just want to encourage you. You're not alone. I know these symptoms can be a royal headache and a royal pain in the ass, for lack of a better word. But sometimes just talking it through helps. And you're not alone. It's okay. I can tell you the condition has impacted me a lot, and I find it to be a royal headache sometimes. Honestly, I have days where I ask myself why I have it, and I've recently discovered so I can help others and be an encouragement. I don't know a lot about it. I'm happy to research anything I don't know. I'm happy to answer any questions. And again, I don't know a whole lot, but I'm willing to research. I'm willing to look into. So, any questions, I am more than happy to answer. But just know that you're not alone. It's going to be okay. It may sound a little melodramatic, but I'm kind of thinking if I were to see a video on this, what would I want someone to say? Especially if I were to write to them or ask them questions about it or anything of that sort. So, again, I'm just here to say that, hey, you're not alone. So, an update on me, not too much. Was currently in the College of Education over at USF St. Pete, but I am looking into possibly switching majors, and I am going to be going from education to social work, which involves me moving over to Tampa College. So I'm looking forward to that. I want to be a victim's advocate for women in domestic violence. This is not something that I have done yet. I'm just looking into getting training and getting certification. Again, about to be in training, not actually certified or anything. So looking into getting training for that, and I'm also going to be training to be a labor doula, which is a lot like a midwife, except they don't do the medical side. I mean, you obviously do work in a hospital, work where there's medical assistance, but you're an emotional support for the mom. I'm like a midwife, except I don't do anything medical, which is really a relief to me because I'm visually impaired. But yet I long to help pregnant women. So I'm very diverse, open to working with anybody. So I'm really excited to kind of see where that goes, and just really looking forward to that. Other than that, not really too much going on right now, and everything's still kind of up in the air. I'm still doing a little research to get the feel for things, trying to find some volunteer experience, and as I said, I'm looking around at a couple places. So other than that, pretty same old. Home for the summer and enjoying life. Feel free to post in the comments if you like. If not, that's quite okay. Other than that, not really too much. Have a blessed day.